minutes about what I regard as the basic challenge for economics right now that arises from COVID. And I think that that is how we are to judge whether the behavioural interventions that have been made around COVID make economic sense. Now, I should say, I think there are a host of other challenges that are posed by COVID for economics in, as it were, the future in a post-COVID world. But I'm not going to talk about those at the beginning, but we may want to perhaps slide into those in the discussion. So I'm going to direct my remarks about the challenge for economics of COVID to the question about how we judge whether they make good economic sense, the behavioural interventions that we've adopted so far. And in principle, at least, economics has a straightforward framework for making sense of that question and coming to an answer. It's cost-benefit analysis. And there are, in effect, two elements to this. And both elements, I think, with respect to its application to COVID, cause problems and challenges. The first element is we have to identify how the behavioural interventions create a health-wealth trade-off. And in principle, we know, at least in the short run, that they are bound to create such a health-wealth trade-off in the sense that behavioural interventions in one way or another restrict the freedoms that people can exercise in order to prevent the transmission of COVID. But in restricting those freedoms in a way that prevents the transmission, they also restrict the scope for economic activity, so that you, broadly speaking, are bound in the short run to create trade-off between lives saved and economic costs in terms of economic output and income that is foregone as a result of the restriction on economic activity. So the first dimension is identify what the health-wealth trade-offs are from any behavioural intervention. And then the second dimension of the cost-benefit analysis approach is to decide whether the particular health-wealth trade-off that is being chosen makes economic sense, in the sense that we place a value on the lives saved, and that enables us then to compare the value of the benefits in terms of lives saved with the economic costs. And the key part of this second part of the framework is we need to place a value on the lives saved. Okay, so first dimension, identifying the health-wealth trade-offs associated with any behavioural intervention. Second dimension is we've got to place a value on the lives saved in order to compare the lives saved with the economic costs of output and income forgone. So on that first part, the health-wealth trade-offs that are created by any behavioural intervention, we know sort of broad brush that the package of March 23rd lockdown measures probably saved something around 100,000, perhaps a few more lives, and in the short run, and the costs of that set of behavioural lockdown measures was, roughly speaking, about 10% of GDP, about £20 billion. Now, it seems to me here that actually we have two types of challenge that go beyond that broad brush assessment of something like the March 23rd lockdown, what health-wealth trade-off it created. The first challenge, it seems to me here, is that is, and is quite self-consciously, it's only a short-run assessment. That is to say, it only looks at, over a 3-month period or so, how many lives were saved and what was the economic cost of those lockdown measures in the course of that 3-month period. And from a public policy point of view, of course, we're not just interested really in the short-run effects, we're interested in the continuing long-run effects of any such policy measures. And I think that there are two things I'd say about that that make us sort of, as it were, less sure about any broad brush figure that we come up with. The first is that it's quite clear, broadly speaking, that in the long run, rising output and income levels are associated with better health outcomes. So we can reasonably expect that there will be some long-run adverse effects on health outcomes that are not observed in the short-run period of 3 months for which we generate a figure like 100,000 lives saved, that really ought to be taken into account when you're looking at the long-run effects of such a behavioural intervention. And I think because we haven't really ever closely studied what the effects of a short, sharp recession like the one that was created with these behavioural interventions has on the long-run health outcomes, it's an area that we know very little about. The other thing I'd say about when we extend the time period here from not just that 3-month interval, but consider it over a longer period of time is, I think there's been a tendency in most thinking about any such lockdown behavioural intervention, and that is that, as it were, the long run is going to be a period where we return as a result of a vaccine to something that looks pretty much like a pre-COVID world. And I think it's become clear as we've entered a second wave that, and there are natural doubts about the efficacy of vaccinations, whether that's quite the right way to portray the long run world. And the reason I mention this is that you can see in a certain sense, just from our experience that we've had with the first wave and the second wave, that have occurred in the UK and other countries, is there's a certain sense in which it may be better to recognize that what's happened with the first wave and those lockdown measures there is that they may have shifted, saved some deaths in that 3-month period, but shifted a number of deaths into the second wave that wouldn't otherwise occurred if they'd have occurred in the first wave. So that these behavioral measures from a long run point of view may not be actually saving lives, they may be to some degree shifting the time at which people die. And there may be sort of quite shortish intervals in which that shifting is taking place. So I think first challenge in identifying the health wealth trade-offs is we've got broad brush short run effects, but frankly, we ought to be concerned with the long run effects. And there we have lack of knowledge over the long run effects of something like a short, sharp recession of the kind that we've had. And we shouldn't be perhaps so sure that we're going to be effectively moving to a long run where it's like a pre-COVID world because vaccinations have dealt with the issue of COVID. The second challenge I think I want to mention here with respect to identifying the health wealth trade-off that's created by behavioural interventions is that it's become clear as the debate around these behavioural interventions has advanced to the second wave set of interventions, that we're really not so much anymore interested in what a package of measures might achieve in terms of creating a health wealth trade-off. We're much more interested in fine-grained knowledge about how particular behavioural interventions are going to produce health wealth trade-offs. And for example, I think we now know that a behavioural intervention, for example, that closes primary schools is probably not going to have a very significant effect upon the transmission and occurrence of COVID and hence saving lives. It'll have some, but not very significant. But would closing schools have a very significant effect upon economic output? Likewise, we know that test, track and trace measures as behavioural interventions here work very differently depending upon whether resources are put into testing or whether they're put into track or trace. They create very different kinds of health wealth trade-offs. And so we need much more fine-grained knowledge about how particular behavioural interventions affect or create a health wealth trade-off. I think the other two things that we've come to appreciate is that actually the health wealth trade-offs that are created by these behavioural interventions are affected by two further things that we know, as it were, not a great deal about in order to construct these health-wealth trade-offs. The first is that it's quite likely that the accompanying economic amelioration packages that accompanied the behavioural interventions, for example, the furlough scheme, will have also affected the health-wealth trade-off. So, for example, it's quite clear that the furlough scheme maintained purchasing power and so reduced the economic costs of those behavioural interventions, so that the observed health-wealth trade-off is partly a consequence of the behavioural interventions themselves, but partly a consequence of the accompanying amelioration economic package of policies. And I think we know rather less about how the economic amelioration parts of the packages have influenced the location of the health-wealth trade-off. The second aspect that I think we, again, know rather less about, but which is conceptually quite clearly there, and that is we know that any policy's effects upon, in terms of creating a health-wealth trade of this kind, is also going to depend upon the extent to which people comply with the policy. And this is, I think, a big grey area that we know very little about, but it's obviously very important for the kind of health-wealth trade-off that any particular policy creates that we then wish to judge. What I would say, though, is this, and I think this is why it gets a tad more complicated, the cost-benefit analysis, is that we plausibly know from other policy areas, and indeed have some evidence with respect to COVID itself, that compliance depends upon, in some degree, whether or not people believe that it's the right policy that's being selected. And that in turn connects this question about, as it were, that I've distinguished between identifying what the health-wealth trade-off is and then evaluating it using the value of life figure that we come up with for the second part of our cost-benefit analysis. It connects the two because there's a sense in which when we ask the question, do people agree with this policy, it's going to turn in part upon whether they agree with, as it were, the value of life that was placed, the value that was placed upon life by the particular choice of that health-wealth trade-off. So, several things then about identifying the health-wealth trade-off itself. Last of which connects and links me directly to the question of how to value life once we know what the trade-off is, so as to make the comparison between the benefits in pound terms of lives saved against the costs in terms of pound terms of income and output foregone. Now, I'll say just something quickly here, so I think I'm sort of past my 10 minutes, and that is, we have in economics a series of sort of off-the-shelf estimates of the value of life. They have been widely used in judging medical and environmental policy interventions of one kind or another. And if we were to use those off-the-shelf estimates of the value of statistical life, and you were to use the figures that I gave you for the broad brush March the 23rd set of behavioural interventions, the lockdown, then you'd probably say that the set of lockdown measures produced a marginal net benefit. That is to say, if you use the value of a statistical life and use the number of lives saved. However, there is an argument to the effect that since the incidence of death was disproportionately amongst old people from COVID, and that the lives saved were amongst those who were relatively elderly, it's not appropriate to use the measures that we have for the value of a statistical life saved. It's more appropriate to use an estimate of the numbers of years of life that have been saved. And if we then use the threshold level for the value of a life year saved that is used by NICE in the UK of 30,000 per year that is saved. And you estimate that between 5 and 10 years on average were saved through those interventions, then the net benefit test for those lockdown measures becomes monumentally negative. So the choice of how you value life here is quite critical, even if we use off-the-shelf measures. However, I think there are good reasons for us being rather reluctant to use off-the-shelf measures, partly because we know these off-the-shelf measures vary quite a lot, and they depend quite critically on the context in which the questions that are asked to derive them, and the context in which those questions have been asked. And we also know that methodologically they focus atomistically on individuals' perception of how a particular intervention is going to affect their own individual welfare. And I think it's quite clear to say that the context of COVID on the first point is quite, to use the word, unprecedented. And so we have little, so to speak, of a representative heuristic kind that we can use to project from previous insights as to how context affects people's valuation of lives saved. But also it's quite clear that the atomistic approach in the questions that are asked to elicit people's valuations of life is not appropriate for an intervention that is preventing the transmission and incidence of death associated with COVID, because when behavioral interventions here are undertaken, they don't just affect you, they also affect your scope for transmitting and causing other people to suffer from COVID and potentially die. So there are important spillover externality effects which ought to be taken into account in people's valuations, which are typically not taken into account in the standard types of questions that are asked to elicit people's valuations of lives saved. So I think I'll stop there. Two sets of challenges around identify what the health wealth trade-off is of any behavioral intervention, where our knowledge is pretty scanty, and likewise the key second part about bringing the costs and benefits into a commensurable calculation. We need a valuation for the value of life saved, and I think we have good reason for not simply dusting off some off-the-shelf estimate that is used in other environmental and medical type interventions.
Can I pick up on kind of what you were talking about in terms of the lives saved? So one thing that I was just thinking is that for a lot of these, when they were looking at sort of doing the modelling and the interventions and when they should act, part of it wasn't just about saving lives, it was also about making sure the health system wasn't overwhelmed. And so I guess there's like that, potentially that added benefit of the idea, I guess, that if you don't do anything, you might have, it's not just about the lives you're saving from that, but it's potentially looking at things like excess deaths that may occur, and the fact your whole health system may completely collapse. So I guess it's just how you incorporate that into kind of the valuation of the health impacts of what you're doing. So it's more than just lives saved, I guess. Is
well, I guess that absolutely right, insofar as there are other health outcomes that are affected here. It's not just lives saved, and in principle, the same approach we can apply once we know what the other health consequences are. Then, so long as we can associate what the value of those are, but we have a quality-adjusted life years is again, one might ask the question: should we be using the normal valuations of those? But in principle, at least, we can elaborate the cost-benefit calculation to include any of those other non-death health outcomes. Absolutely. But I'd say it seems to me that no, I'll shut up then.
No, I think.
Sorry, I was going to say we don't really know about the sort of knock-on effects, or not very much about the knock-on effects on other diseases and things, especially in the long term. I mean, I know we've got the excess deaths, but going forward.
Absolutely, I absolutely agree. I mean, it seems to me that as I say, this is for me the challenge of moving from these broad brush but understandable figures that suggest maybe 100,000 lives were saved by March 23rd over a 3-month period. But there's this real challenge of moving from there to the long run. And the long run could be another year, 6 months, or another 3 months. And again, with the excess deaths, you're absolutely right. We know the excess deaths were much more than the numbers of recorded COVID deaths. But what we're going to have to wait is for several years before we see whether those spike in excess deaths are actually accompanied over the next 3 or 4 years by some smaller number of excess deaths. And those are the imponderables here. But from a public policy point of view, it's absolutely right. We've got to somehow be able to look beyond the 3-month period and see the effects of this policy in the round over a longer time period. Although my word becomes a tricky issue here about sort of, as it were, whether you should discount those future deaths relative to current deaths and stuff like that. But I mean, before we even get to that, we've got to know, roughly speaking, what the nature of the problem is about how the profile of deaths over a much longer period of time has been affected by these interventions, and not just how it affected deaths in the 3-month interval. Absolutely. And presumably,
we
don't know.
Serious morbidity going forward needs to be weighted in there too somewhere.
No, absolutely.
We don't know what it is. So,
yes. No, I mean, one way in which I sort of think about it is, you can imagine over time the sort of health outcomes which might be death or a series of other things, and what we know is what might have happened in the 3-month period of the behavioural intervention relative to what could have been predicted to happen without it. But what we don't know is what the ensuing 2 lines might have looked like for those health outcomes over the following Z months.
Yeah. So I think Andy wrote a comment in the chat, so I'll just say it so that so he said, excellent. I was also wondering about excess deaths in healthcare systems in the US. Decline in elective services due to COVID have hugely disrupted healthcare.
Yeah.
I think I was going to say, I mean, I think that there are all sorts of interesting sort of things that are difficult to do on a sort of balance sheet cost benefit analysis thing. I mean, I think the effect on other causes of death is really a bit like the sort of classic philosophy problem where you're faced with, would you like to save the life of the person in front of you at the cost of killing several other people, but you don't know who that is? It's some kind of statistical thing as to who's going to get affected. And the analogy here is, I mean, people turn up at the hospital with COVID-19, you have to treat them immediately. And you're not really allowed to do the assessment that, sorry, we're going to let you die, because actually, if we treat you, we're going on statistical grounds. Suppose you could say, I'm going to actually miss out on spotting 100 cases of cancer, which I would actually save more lives if I took my time and dealt with them. So I think there's that sort of immediate trade-off problem, which I think is probably going to come up in Bernard's. Perhaps we shouldn't chase that hare, because I think that will come up in Bernard Silverman's thing about why is COVID a wicked problem.
Can I just say something
Yeah.
about that, Dennis? I mean, on your first point, the second point I absolutely agree with about, actually, as it were, there are rules of operation inside a hospital about how things happen. And so, it's like they are effectively making these decisions as a result of those standard operating procedures. And so it's not something that, as it were, we have any control over that level. Once it happens, the events unfold. It's a consequence of those operating procedures, how we're, as it were, locating ourselves on those difficult decisions. And it's, in that sense, not a conscious choice, but it's a consequence of those standard operating procedures. On the other point, though, the sort of, as it were, the slight aspect of this, which I absolutely do agree with, resembles qualitatively the trolley type problem. Economists are quite clever about eliciting people's valuations of those by making them choose between options. And you can, as it were, set up quite choices between death now due to COVID and subsequent longer term deaths that are associated with the failure to treat underlying other forms of morbidity. So I take the point, philosophers do worry about that, but actually economists have rather clever ways of actually forcing people to reveal how they value one against another. Now, we don't know why they do, which is of course what worries the philosophers, but we do have ways of eliciting those apparent valuations.
But a point I would like us to get on discussing, that it's a rather more diffuse one possibly, is the whole idea of assessing what the costs are, and the possible inadequacy of doing that through GDP.
Yes.
A whole host of, now, in normal circumstances where you've got a roughly equilibrium economy, I think it makes reasonable sense to assess things in terms of GDP. But once you kick the system as hard as it's being kicked at the moment, I really think it's questionable, and maybe sort of elements of thinking of things more in terms of well-being rather than just cost become important. I mean, for instance, the disruption to young children's education by closing primary schools may not actually run up as much of a cost in the economy, but in terms of social justice, those children, of giving them an education, it seems to me there's a very large cost, very large societal cost there. There may be other things, like maybe people traveling less, which in terms of GDP comes out as a big negative, but actually has a lot of side effects, reduce pollution, save time, and so on, that actually make it one of those occasions where actually it's a bit of GDP you don't mind losing. And a final third point on the costs, it seems to be, again, in exceptional economic times, we have essentially the government printing money, which is rather sort of quantitative easing kind of thing. And it's actually not clear to me that if the government, let's say, prints an extra 10 billion of money to support the furlough scheme, that actually, in the present circumstances, that really doesn't matter. They, as it were, get away with it, that's not a real cost that we actually have to bear. At the very worst, it becomes part of the national debt, which we pay sort of like 0.5% interest on, or at least if the government's borrowing from itself, we probably pay essentially no interest on. So all these reasons, I think, when you get exceptional circumstances, we could call that a separate challenge, really. We could say, with a major disruption like this, how should we really assess the true cost?
No, I absolutely agree that, as it were, there is no good reason to, on the cost side of this ledger, focus just on the loss of output and income. Absolutely agree. And in principle, all economists would agree. And again, we have ways of placing value on the reduced pollution that occurred, blah, 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 all that. And so in principle, absolutely right. And indeed, absolutely right to say that conducting the cost benefit analysis here ought to include those costs as well. Absolutely agree. What I would say, though, is I think the first point that you mentioned on the equity aspects is absolutely something that the cost-benefit analysis approach simply does not incorporate. And so that seems to me to be, as it were, a challenge which is outside the cost-benefit framework. And of course, absolutely right to say that COVID has presented quite significant equity shocks. So every good reason to be interested in evaluating policy responses with respect to equity, as well as what us economists refer to as efficiency, which is what the cost-benefit analysis is looking at, as whether, as it were, from the point of view of maximizing the available material sources of well-being. This is a policy that, given the shock that occurred, makes good sense because it did the best in a bad set of circumstances for making as much as could be made available for our well-being in that sense. So I absolutely agree with that, and it does seem to me that, well, economists have always been very bad about worrying about how policy interventions affect a desiderata of social justice. They've been always much better and more alert to questions about how it affects the material aspects of our well-being. Boom. One thing I want to say about your final comment, though, is I think that the furlough scheme and the printing of money effectively to pay for the furlough scheme and other ameliorative policies, they have affected the nature of the health-wealth trade-off, broadly now understood, where wealth will include all these pollution things, health will include all the other health outcomes and not just death. So it's a sort of expanded sense here. That has affected the health-wealth trade-off, without doubt. And you're absolutely right to say that the future cost of that intervention, because it is a future cost in terms of the borrowing associated with it, is probably very, very small. However, I think there's no doubting, though, that the loss of output and income, it may well have been smaller than it otherwise would have been as a result of those furlough policies, and that's the great advantage of them, whatever the down the road costs associated with that future debt burden. But there's still undoubtedly a economic cost in terms of the output and income that was foregone and that will never be recovered. It's just gone, you know. So had we had something close to full employment output as we had before COVID, we'd have all been a certain amount richer than we otherwise were on average. So I think there are two slightly separate things. That undoubtedly meant that the loss of output was smaller, but we can't avoid the fact that there was a loss of output and a loss of income from.
Again, I suppose the coming back on that, the question would be: is the loss of is the loss of output that is really essential to and important to us, or have we actually lost some output that we would do well to lose if we want a more sustainable future?
Well, as I say,
the whole question of growth, degrowth,
yes,
green growth, and so on.
Absolutely, but I'm very happy, as most economists are, as it were, to not make the cost here turn on GDP. It's GDP, you know, adjusted by whatever those other things are that are important for our well-being. So, yeah, and indeed, you know, it's always been one of those. Well, I think most practical pieces of cost-benefit analysis usually make some quasi-serious, more or less serious attempt to capture those other non-monetized benefits and costs associated with any policy intervention. And they would do the same if they were conducting a serious piece of cost-benefit analysis on something like these behavioural interventions as well. So I think in that sense, economists are very happy with that line of argument, take it into account and do make serious attempts to do so. This is, of course, a rather big shock and it may pose bigger problems, but in principle, it's not something that there's any pressure against, or indeed there isn't any habit of doing that, actually. I think they do, you know, it's, yeah.
Can I come back to the point about the, I think related sort of to the true costs and things like that? I wonder if some people have been looking at like willingness to pay studies and things like that.
Yes.
Is that one way of kind of eliciting how, I guess, that's kind of like the value of life, what
Yes.
people value the life to be,
yeah,
isn't it?
yeah,
Like how, and whether they, so that's kind of fitting in as like another way. So what do you think about sort of doing, about people who've been doing these willingness to pay studies and the challenges in?
Oh yeah, when I referred to you know, economists having these sort of cunning ways of eliciting people's values, they typically involve more or less sophisticated versions of questions like, historically at least, not for the COVID case, but historically in generating these value of life estimates, they'll say, how much are you willing to pay for an environmental intervention which lowers air pollution and so reduces your chances of dying from respiratory disease of one kind or another from 3 in 100,000 or 1 million or whatever it is to 2 in 100,000. How much are you willing to pay for that intervention personally? And they give you some figure, and you can then either sample across a large lot and take the average for the population and see for 100,000 people what is the sum of money that's placed upon saving the 1 in 100,000 from that intervention, or you can simply assume that that's the average in a sample and gross it up to 1,000 and come up with the value of a statistical life. Now, that's absolutely we call it the stated preference approach. We get people to choose or decide, give a figure for what they're. We have another way, which is we give them a whole series of options. And in each option, they have to choose between one or other. And as you run down the options, there's a sort of switchover point between them, which reveals, without them knowing it, the implicit value that they're placing on a life saved. And so, yeah, and so that's exactly it. And that's how economists now typically generate these values of statistical life. Historically, and there's often a cross-check that takes place with these stated preference valuations of life, with the sort of premia that are paid to jobs that are otherwise involving identical skills but involve more risk to life. And you can back out an equivalent sort of market-based value of life from those differences. But mainly these days we rely upon exactly these kinds of willingness to pay, or a set of choices between binary options to reveal yeah, how people value a life.
Andy's written something more in the chat, so I'll just read out what he said. I wonder if long-term is worth considering relative costs and benefits of treatments versus vaccination. Both of these will be dependent on duration of immunity, but it seems likely cost of treatment may decline, while vaccination will have fixed cost per person, plus treatment will be significant age-dependent cost variation.
I absolutely agree. I mean, it's to my mind, you know, sensible policy making in this area has got to move into this long run and think seriously about actually what policies we're pursuing, not just now, but what their long run consequences are and what we think the various possible long runs might look like and what those long run choices are between things like putting resources into treatment as compared with putting resources into vaccination. And it to my mind, it is well, I don't say the most, but a really significant part in which we don't really understand well what the health wealth trade-off, construe these terms broadly to satisfy earlier comments from Dennis and yourself about this, okay, is what the health wealth trade-offs are that are created over this much longer period of time. And I do think that, funnily enough, I mean, my own impression, and I don't know whether it's an impression that is shared, but I think the interest in treatments now, whereas it was definitely the sort of poor relation to vaccination at the start of COVID, but I think that actually it's become much more significant in people's policy thinking as COVID has unfolded than it was at the beginning, for exactly these reasons. Doubts about the period of immunity that will be brought from a vaccination, and an understanding that it may be as a result of very much more long drawn out exit from COVID than a simple nice snapshot finishes in, I don't know, April or something, and we return to a pre-COVID world, because it does look less and less like that. Yeah.
So the looking at like the long-term impact seems to be quite important, and I just wondered whether there's anything with environmental economics that can be learned, because obviously I guess environmental economics, that's something I believe they grappled with for quite a long time, is they're often looking at very long-term impacts, and that's where they have issues of things like discounting, like you kind of briefly mentioned before. And so I just wondered whether there was any, I know sometimes these fields can sometimes be a bit distinct, so whether there's any lessons that can be learnt from sort of some of the environmental economists about ways that they deal with and uncertainties over what potential impacts might be, and things like that, looking at this long time horizon.
Well, I'm not an environmental economist, and so they may well tell me there's all sorts of magic in there, a box of tricks that I don't know about. And but I would say that the basic problems are always about knowing the various counterfactuals between how the long run is going to unfold with different policies that you adopt now. And that's, in some sense, very similar to the problem that I'm raising here about we have to be concerned not just with the effects of any policy over the 3-month interval that it's in our uppermost minds, but we have to have an eye on how it will affect our unfolding future. And I think environmental economists have a similar problem. I don't think over something like the climate emergency, it's anything like as acute as our lack of understanding about how these health outcomes may have very different time profiles in the future. But I would say on the sort of difficult policy issues, they encounter exactly the same problems as I'm suggesting here. I mean, it's partly this knowledge thing, although I think that's less severe. But there is this real issue about what is the appropriate discount rate, which bedevils lots of discussion over certainly climate emergency policies amongst environmental economists. But I think there is a sort of an interesting thought that is often argued amongst environmental economists, that in a sense you might be able to cut through all of those difficulties of what discount rate to use by adopting a kind of precautionary principle, which says you should, as it were, look at what the worst outcome is of each policy that you might be undertaking now, and make sure you sort of maximize the minimum in that sense. And I think you might be able to make a similar argument here, that in thinking about behavioral interventions now and their long run consequences, you might want to adopt a sort of precautionary principle insofar as you do have the knowledge about how the long run consequences of a policy are likely to unfold. Then you should be looking to maximize the minimum, or choose the one that has the best worst prospective outcome. Yes. And so I think that would possibly be a lesson here. That, yeah.
I'm just slightly changing topic, but kind of coming back to something you said earlier about the fact that a lot of these interventions have externalities. And so I was just wondering whether that's an argument for linking up epidemiological models with economic models more, because I guess that epidemiological ones can kind of capture this this externality of the fact that if I am treated, then I effectively don't infect this person and that person. And so saving my life or saving me from getting COVID actually saves hundreds of thousands of people or hundreds of people, something like that. So I wondered, I mean, I know there is some work on linking, has been done on linking up epidemiological models with economic models. I know there are challenges in doing that in itself, but I just wonder if, you know, I mean, and I guess this feeds into this idea of, I guess the challenges papers are supposed to be, we've talked a lot about the challenges related to COVID, but also thinking about if in 10 years time there's another pandemic, you know, wouldn't it be great if we had a framework where we had great models, where we had epidemiological models automatically connected with economic models, and we could be doing all this analysis very nicely. And so I just wondered what you thought about that, whether what people you knew were doing that, what challenges you see with trying to address that.
Well, let me start, give you a quick thought on that as you were sort of speaking, and I may change my mind as I'm speaking, so sorry about that. But my first thought is that, whilst what you say, I think, is very important about, as it were, the fact that this isn't like, you know, if I suffer from some respiratory disease as a result of there being greater air pollution, it doesn't mean that I transmit that respiratory disease to other people. So that when we ask these willingness to pay type questions to elicit the value of life, we're missing a very important part with COVID that is completely overlooked, quite naturally, for lots of environmental interventions. And so I think what you're alluding to here is very important. I think it's not so much a point about that comes from marrying the epidemiology with the economics at that point, though, because I think that that's a question, that insight is a question that we need to take over to how we frame those stated preference willingness to pay questions. And they have to be framed differently so that people can answer in a way that allows them to take account of whether they personally value the fact that if they catch it or don't catch it, it has an effect upon other people. And you have to ask them a question which allows them to take that into account. And our standard questions don't allow that. And when they've been asked in the past, they didn't have to, but they do now. So I would say that on that. Let me say, just again, following on from that, it seems to me that where I've always thought the epidemiological models are crucial is actually in understanding how any of these behavioural interventions, whatever they might be, are going to produce certain health outcomes. And then you understand, you know, the economists beaver away then at what the, as it were, the economic outcomes might be, so that the two sides of the health wealth trade-off that a behavioural intervention has. I always think of it as like, so they get married together in that sense. When you're saying, here's this behavioural intervention, it produces this health wealth outcome, and the health side of this has been importantly influenced by an epidemiological understanding of how these kinds of diseases get transmitted, blah, 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 blah. And the economic cost side of things is, you know, a sort of standard fare for what economists go about thinking about what is the consequences of having these restrictions. I have to say, I mean, we although, you know, there were these estimates quickly that came off, and indeed, you know, the IMF at the start was saying about 10% for loss of GDP for the UK over these 3 months, and it proved to be just about right, actually, you know. But we had no sort of prior knowledge about quite how best to model something like these lockdown measures. But that's how I'd see them coming together. The thing that I would just say though here is, it does seem to me that in the epidemiological work that's associated with trying to understand what the health outcomes are associated with these behavioural interventions, and this is where I do think there is a deeper connection between the, as it were, the economic modelling and the epidemiological modelling. It's not just that they've got sort of a division of labour going on here, one on the health side and one on the wealth side, is that the health consequences of any behavioural intervention must depend upon what you assume about compliance with policies. And I do think that, you know, compliance, well, obviously, if we don't have a vaccine that proves effective for reasonable periods of time, is going to become more and more an important question about, do people comply with the policies that governments choose? And so I think in the epidemiological modelling, compliance has got to be important with when it's a particular behavioural intervention. I mean, you can make an assumption about what compliance is and follow it through, but compliance there is a real crucial variable. And I think that takes you back to the valuations that people place upon lives saved from these policies. And because by and large, we have some evidence in general, it is also the case, people comply with policies that they regard as legitimate, that they in some sense think have either been generated in a procedurally legitimate way or that they agree with its substantive content. And so if they think, as it were, these lives are worth saving through this behavioural intervention, then they will comply with it. But they won't comply with it if they think that the lives saved aren't worth the economic costs. And so I think that way, as it were, the economic analysis here needs to be directly linked into the epidemiological, because there's this bridgehead between the two of compliance that's important for both. So I think, yeah, it's well, I have no idea what the behavioural scientists were in some sense drawing on SAGE about these issues of compliance, because I think we have, you know, just very, very limited evidence about when people comply with a policy like this. We've got a fair amount of evidence about ordinary types of policies, but I think pandemic type policies, I think we have very, very little evidence about it, and we're developing it now. But it is, to my mind, absolutely a challenge for the future. And if you're thinking about how do we prepare ourselves for future pandemics, then it's really understanding that box better, you know, is what is it that, yeah. And I think that box will draw the economics and the epidemiology together.
No, that's so good. I've heard that said before by economists that they feel epidemiologists sometimes sort of ignore that, you know, whether you keep your children home from school when they've got flu and things. Yeah. So I think some people have done a little bit of looking at this from for like things like flu, I think, in the past a little bit, but yeah.
Well, I think we know about that, but what you see, what I think we don't know is yeah, some people do keep their kids away from school when they have gastroenteritis. Some don't, you know, boom. And it's and so we know about compliance with rules that schools have on things like, and likewise with flu and so on and so forth. But I don't think we know a great deal about what influences compliance with, say, no social mixing. You know, we have no experience of saying no social mixing, you know, and yet, particularly if it takes place inside, I mean, I take it what we know about transmission from the epidemiologists is that it seems that's the crucial thing where transmission takes place, is social mixing inside spaces. But you know, and so any policy that touches upon that seems crucial for the epidemiology, but we know, I don't think we really know anything about, you know, the rule of 6, or, you know, such rules, you know, I mean, what influences whether people comply with that? I mean, we know general things about policy in general, because, you know, there are lots of policies like littering. Why do people comply with littering, or don't, you know, because and typically they'll comply if they think it's legitimate and sensible and they agree with it. Also, they'll comply with it if they think it arose from a procedurally fair procedure, even if they don't agree with it. We know those kinds of things, but I don't think we know whether, well, there are, something like social mixing, which is quite crucial for the epidemiology. I don't really know anything about that. For example, basic things like I don't think we know for that whether it makes a difference whether this is guidance or it's a legally enforceable rule.
Or even if it's supposedly legally enforceable,
yes,
are there
exactly.
any mechanisms to enforce it, and therefore does it actually matter?
Yes, exactly. Which, yes, legally enforceable, but on reflection, impossible to do so. Yes, exactly. No, and I think, we simply don't know with something as crucial in pandemics, which looks as if, certainly for a pandemic like it's this social mixing business inside.
To answer, I think, one of your earlier implicit questions, I would imagine that the people on the behavioural advisory body for SAGE are probably completely tearing their hair out at the way we have these policies, we end up with policies which are ill-defined and badly understood, and have the people get the impression, at least, that they're changing from one week or month to another.
Oh yes, I agree. I think that they can be pretty clear about, as we know that no policy has much good effect when it's not clear, or indeed when it chops and changes. Yes, yeah, absolutely, yeah.
What about Andy's? Well, there's a couple of questions here, but the second one about splitting GDP into different contributions and looking at the relative impact in different sectors of impact of compliance and the epidemic on each of the sectors. Is that, how feasible is something like that?
Oh, I think in principle it is perfectly feasible. Yeah, no, it is. I mean, it's not something that I've ever had anything to do with, but I mean, we have quite disaggregated models of the economy. They're versions of what used to be input-output tables that people still use to, as it were, disaggregate some economy-wide total, and therefore model how, if you operate on particular, or your policy has differential effects on particular sectors, how the interactions between sectors will then have some knock-on consequences for other sectors and feedback on themselves. So in principle, I think that, yeah, that's, and I imagine, for example, that there will have been some such modelling going on in the COVID context, not that I know this, but because of the way that the behavioural intervention measures have been, well, very uneven in their effect upon sectors. Obviously, the tourism, leisure, hotel type industries, air travel and so on and so forth have been particularly affected, whereas we all know that online deliveries have grown enormously during COVID, and so there has been very differential sectoral impacts. Yeah.
What about international variation? I mean,
yes, I know. And international variation is very interesting, because you would think that this was a great vehicle generating evidence with respect to how, when I was talking about we need more fine-grained evidence about how particular behavioural interventions have affected the health-wealth trade-off, or have created different health-wealth trade-offs. And you would think that that was a great source of evidence in evaluating what they are. It seems to me, again, I have no knowledge of serious work that's being done on this. There's a lot of anecdotal stuff when we compare Sweden with the Netherlands or so on and so forth, and wonder at the marvels of how Germany has with its decentralized system, manage much better health, wealth outcomes. But I think the tricky thing with identifying from that cross-country experience is what we've got that distinguishes different countries' performances with respect to the generation of health, wealth trade-offs are in effect two things. It's partly the policies that were chosen, which is what we'd like to know about, but frankly, it's also a matter of competence. And you know, it's quite clear, I think, that, you know, as it were, if you look at our policy response, we have produced a test, track and trace system, which is a much more significant policy intervention than in probably any other European country, not the US, but then probably any other European country. But the realization that for much of its time period, it's been simply incompetently administered means that the UK experience with such a large test, track and trace system wouldn't be a good test of whether it's effective in producing better health, wealth and outcomes than a smaller one, because it's been incompetently administered. And I say that because of these revelations that, you know, all this resource was put into increasing the capacity to test to the detriment of the time period that you then trace the following contacts from. And of course, you know, a moment's reflection, you would think, suggests that there's no point in doing the testing unless you're going to follow up with track and trace within a pretty short interval, because, you know, obviously if you wait a week, you know, you're closing the stable door after all the animals have left. And so, you know, I think that the tricky thing with, I mean, it's obviously going to be a very good data source as time unfolds with this and cross-country comparisons. But I think right now it's very difficult to disentangle the effects of different policies from different levels of competence in implementing those policies across countries.
And the whole difference is in sort of behavioural responses from the population too.
Absolutely. Getting back to the compliance point is,
you know, do we know? I mean, presumably we all know anecdotally, but presumably there is more sort of formal knowledge of differences between countries in terms of their attitudes. Well, A, their attitudes to compliance, and B, the whole valuation of life anyway. So when you're thinking about, you know,
actually, funny enough, the value of statistical life, certainly amongst OECD countries, you know, these stated preference questions, the willingness to pay type questions that we were talking about before, they're conducted in all sorts of countries. And there is obviously cross-country variation in OECD countries, but I would say it's not as significant as the variation that you get on the context of the question asked. So I would say, off the top of my head, you won't find that the average valuation of life is very different, statistical life that's listed in these, between the US and the UK. The big difference is if you say evaluating some safety measure, like putting in crash barriers on roads, as compared with some safety measure in air travel or rail travel, that's going to produce the same reduction per 100,000 people who use that mode of transport, a reduction in lives lost on that mode of transport, then people will place a much higher value of life on the road, the rail and the air line, lives saved through that safety intervention, as compared with the safety intervention on roads. And I would say that the big differences that emerge are typically between the context of the decision that you're being asked to place a value on life. Is it road versus rail or air? Than it is whether you ask those questions in the United Kingdom or the United States.
I'm afraid I'm going to have to leave in a minute. Valerie, what do you? So I was going to say I'll set up a Slack channel and make sure everybody is on it, and we can put down some. I've taken lots of notes, so I can put some initial things that we've been discussing here, and I'll put the link to the recording.
I think what would be good would be between us, if we can decide how best to sort of capture this. We've got the recording, but to start off capturing some of these challenge points. I mean, Sean wonderfully set out the whole sort of a big area extremely clearly. So it should be fairly easy to at least identify most of the issues that we've touched on during this discussion, and try and sort of capture them in a set of bullet points that we can then think about further, but whatever people think, really.
Can I make one connection actually that between the various bits, which here is that what I think is I've suggested that these value of life questions are important for compliance, because if turns out the government chooses a policy which people just don't think is appropriate given how they value lives saved, they won't comply with it, or they'll go beyond compliance if they think that more is required, and that's so actually their behaviour is quite crucial. I've focused on the connection that has with the value of life measure. But I want to return to a point that Dennis made that I commented on and said that there are these sort of, as it were, cost-benefit type calculations, which are important, I think, for people's implicit compliance or agreement with a policy. Does it seem to make sense with their own values here? But another part of this is the equity side, and I think it's going to, as it were, prove very important for something like a pandemic of the COVID kind, is that compliance will depend also upon the social justice aspects of those policies, because COVID has had such unequal effects. And so I think the behavioural interventions, part of the do people comply with it won't just be, does this represent a point on the health-wealth trade-off that I think is sensible given the value that I attach to life, is going to be something to do with, do I think that these policies produce outcomes that in the circumstances respond to my notion of what social justice is?
Dennis and Valerie, do you think that kind of potentially that's like a crossover point, as with many of these discussions in the challenges are, with the policy, with the linking to policy challenge discussion tomorrow with Hannah? Just a question that kind of, oh, Dennis, I think you're muted.
So yeah, yes, back reinforced by coffee, thank you. I was wanting to look at other crossovers too, and I thought, well, why I'm doing that was to see if we might shift the discussion to preventing future pandemics and surveillance and emergence and so on. Because I think that, in fact, I was saying to Valerie when we last discussed this that the actually, if you look at all the challenges, you could probably sort of find an economic angle. So I think there are a lot of crossovers, and I think it would be good to explore those, and it might end up with some of the things we come up with being hived off, as it were, to a different aspect of the challenges. But I think that here would be a good place to raise them under the, I suppose, the overall heading of doesn't economics affect almost every one of the epidemic challenge theme areas?
Yeah, I mean, I think you must be right in terms of the moment it becomes a policy question, you've got to think about alternatives and how you're going to judge them.
And I was thinking that it might be more, rather than that there might be different parts of economics you might want to talk about, but I mean, I suppose it's more like sort of decision theory or game theory sort of thing. I mean, thinking of the yeah, because I mean, we have a problem looking forward to possible future pandemics of trying to persuade the world, let's call it, which major countries and the WHO, that they should institute and maintain an efficient surveillance system and better preparedness for the future. And I was stop. I'm sorry. I apologise if you've already heard me say this, but I was thinking, well, actually, it's not. It's all right. It's an insurance system. Surely you can persuade countries they ought to pay an insurance policy to prevent future pandemics. But the trouble is, with standard insurance, you see that you get value for money because your house burns down, but thank goodness it was insured. Someone comes and builds you a new house. You insure against future pandemics, making sure you can snuff them out and get rid of them. And there's this alarm, another new disease emerges in some part of the world, but thankfully we've got our surveillance and everything in place, and it's all suppressed, and the immediate cost. But the trouble is that the cost that's then perceived of that pandemic is very small. It was a few millions. There were perhaps a few hundreds or thousands of cases, perhaps like SARS, and everyone breathes a sigh of relief. But they don't. But if they've been paying very large, as it would have to be, I think, insurance premiums, there may be a sort of psychological perception that they're not getting value for money, because what they're not seeing is they're just not seeing the pandemic that's been prevented. I mean, suppose that everything had gone right with this one, and somehow the Chinese had managed to get on top of it and suppress it before it could get out of Wuhan. We wouldn't be having this discussion, would we? Those of us who were really in touch with epidemiological information might be sort of thinking, well, there's another near miss. We really must persuade WHO to ramp up its preparedness. But we would be doing the usual thing of banging on people's doors who would say, no, we've got higher priorities. There's Brexit, there's this, there's that. Yeah. We can't afford to increase the pandemic budget.
Yes. No, I think you're absolutely right, Dennis. I mean, this is one of those sort of paradoxes, isn't it, with any kind of preventive intervention, is that insofar as the intervention is successful, the sort of people's willingness to subscribe to it just atrophies because they don't experience what the ill is that the preventive measures are designed to prevent. And I think it's a real conundrum with any kind of preventive intervention, is that the political will for it disappears if it's successful. And so it can never last very long. What I would say, though, is it seems to me I would be amazed post-COVID if everyone's perception of background risk hasn't increased enormously.
So I suppose
that may sort of,
you have to seize the moment, don't you, Sean?
Seize the moment, exactly.
In 3 years, it'll probably have worn off.
Yeah, exactly. Yeah.
So I think that
it is. Yeah.
I think it's very important that if there are, I think it's very important to try and come to some informed view of what kind of improved surveillance and preparedness is desirable at a world stage, and to push for very immediate action to essentially sort of lock in funding for that, to agree that that is worth spending 100 billion a year on, taken across the world, say whatever it would be, and get that sort of locked in before people. So it'll probably get whittled away over the years, but at least if you started off at least, you're quite right. I mean, seize the moment that hopefully people can see the point of paying that at the moment.
Yeah, no, I absolutely agree. Yeah.
I wonder if Andy would like to comment, and possibly through the chat if he's...
I think he did. He said, although I suspect cost of epidemic prevention are significantly less than cost of military preparedness or next moonshot, and indirect benefits are multiple and benefit many.
It could be tied. It could be tied to my campaign, which is to, in view of the the American-led persuasion that everyone should increase the percentage of their budget they spend on NATO, on defence. And my campaign is to try and reduce that, and to reduce it, but by trying to get agreement across countries. Instead of being frightened of Russia, we should be saying to Russia, look, we're prepared to reduce our defence spending to 1% of our budget if you'll reduce yours a bit. And of course, the small change saved might well be enough to set up the pandemic surveillance system we want.
But Dennis, just coming back to your point about the, needing, like, the economic argument for needing preparedness for pandemics, people have looked at this before. So, like, people have used sort of a real options approach about, there was a paper in, I think, PNAS a few years ago using a real options approach about how much people should be investing, and looking at opportunity costs if they don't, and things like that. So, I can post all those papers in the Slack channel and things, but I think it's an important thing to include and to raise on, and there might be sort of some work already happening that we can kind of branch off and look at.
I mean, maybe the natural place for this might be in the policy theme or something, because I mean, I think there's thinking ahead to future pandemics. There's part of preparedness, there's the economic part of preparedness, but there's also actually the willingness to act part of preparedness, isn't there? Because it's I suppose being prepared to look foolish. A system that really will keep on stamping out possible disease X's will be ones where a lot of the time people say, you didn't need to do that. We've looked at we've now looked closely at the immunology, and we can see that particular pathogen never had a chance of being a pandemic agent. You've just gone and wasted a couple of billion. But it's being politically prepared to take decisions that look foolish, and the whole sort of timing of things. I mean, there's a lot of, at the moment there's a lot of criticism of China for, quote, suppressing the thing, but which perhaps lost a few weeks. But then all the countries in the West had the information to have acted many weeks earlier than they did. So again, it's not trying to attribute blame, but it's just trying to think, why do governments behave like this, and can we in some way change the setup so they don't behave like this next time?
Well, of course, the classic policy device that gets used for that is to shunt off responsibility to a independent body, isn't it? I mean, it's what we did with setting monetary policy, with making the Bank of England independent, was to prevent the short-term interests of politicians holding sway over decisions that were going to have much longer-term consequences. And one presumably might think of devices like that for matters of pandemic preparedness.
Isn't that, Sean? Isn't that supposed to be there? That's WHO, the WHO, and so I mean, well, again, a big
WHO is, but WHO.
Why the WHO? Why was the WHO so overcautious in asking for action? There are several big stages in the WHO procedure, which essentially put the brakes on people taking the action they should have. And that wasn't because people in WHO didn't really know how serious it was. I think it was because they were locked into a situation of politics where they didn't feel they could go as strongly as the scientists would probably have liked them to.
It's an interesting question. I don't know anything really about.
I bet there were scientists in WHO who in early January were essentially would have said things like, we should stop all international air flights from China for a week or two. We should, absolutely have instant lockdowns to stop this thing, and they will have felt that was politically impossible, I think.
I'm sure you're right about that. I mean, it seems to me that any version of this that is the international analog to making something independent has as a sort of a institutional device to as it were, keep the long-term interest in, in these matters kindled, adds an additional layer of complexity because of the way that, you know, well, it's international and so poses a problem for all sorts of reasons about these decisions mainly being made nationally. And so there's questions about the legitimacy of any international body in these matters, blah, blah, blah. Creates all sorts of free rider problems internationally and so on and so forth. So I think there are real layers of difficulty there. And so I must say, when I was thinking about an independent body in charge of preparedness for pandemic, I was thinking much more on a national level. And that then they indeed might be the conduit for connecting up with something like WHO, so that the WHO becomes insulated from these political pressures because they're dealing with national bodies that are insulated from these political pressures. Yeah. Because I don't think by itself you'll ever insulate something like the WHO from these political pressures, however cunningly you design the internal decision making so that it might do. I don't think it will. I think you've got to somehow make the break between those political pressures that arise at a national level being fed through to the WHO. And I think that would be to, you know, as it were, create the national independent bodies that had the funding that then went to the WHO. So you put the breaker in at the national level.
I think we've morphed onto the policy challenges at this point. But anyway, so have we gone as far as we can, or is it just me who's feeling in need of the cup of coffee Dennis is already
I'm waving my cup at you.
Well, especially as we started at 8:30, so I'm ready for a cup of coffee. Anyway.
Yeah, well, maybe we should say thanks very much, Sean. And I think
it's really very good.
I think it would be. I mean, Kira was saying that it'd be nice to get Chris Dye involved on this sort of planning sort of side of things. So
that was me and Andy, but anyway,
maybe might take place in the policy discussion, but equally, if it does take place there, I hope that economists like Sean will come along and join in there, because I think you know, I think there are definitely overlaps between many of the themes to be considered.
Well, I've much enjoyed it. So
well, thank you very much. So keep in touch via the chat. So we've got the recording. Can we easily capture anything in the chat that's relevant? The odd link that Andy put in.
I'm sure there's a.
There should be something for. It's a.
Paul, are you there? Could you just save the chat and maybe
well, I don't have to check.
And Kiara's setting up a Paul. If you could email the chat to Kiara, she's setting up the Slack channel for this, and she could post it in there.
Yeah, she could edit anything that's relevant.
Okay,
I've saved the chat already.
Oh, you have. Okay.
Oh, that's great. Thank you. So, so where have you saved it?
I'm not really sure. To be honest, I'm not sure. It says save the chat, so I did, which is what Kira told me to do before. So,
oh, great.
Hopefully it'll save it onto the.
It'll be, yes, it'll be up there somewhere. So, up there.
I've done a quick copy and paste in case everyone else loses it.
Okay, that sounds great. So hopefully we can pursue this further through there and maybe have another discussion when we've tried to get a coherent list of points.
I think we might see how the policy discussions and so on goes to whether we want to follow things up by having further meetings of exactly the same groups, or whether we want to get two groups together or something. So I think the best thing to say would be keep an eye on the bulletin. We'll make sure that you know, if there's further sessions that they're either put in the bulletin or emailed
Well, I think we'd email round the group to make sure that everybody knows what's going on. But the first part of our discussions was much more sort of clearly focused on the economic economic sort of interaction, wasn't it? Which would be, so probably that would be separate, I would guess. But
yeah.
Anyway, good. Thank you very, very much.
Okay.
Thanks for preparing that, Sean. That was great.
No,
Thanks,
And
Andy.
well, nice to see you all. Bye-bye.
Bye
Okay,
then.
bye.
Bye.
Bye.